Hi guys, today I will be reading what is depression, and I'll also talk about my own experience with it as I am experiencing depression right now. So depression, or a major depressive disorder, is a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. Fortunately, it is also treatable. Depression causes feelings of sadness and or a loss of interest in activities once enjoyed. It can lead to a variety of emotional, physical problems, and can decrease a person's ability to function at work and at home. Depression symptoms can vary from mild to severe and can include feeling sad or having a depressed mood, loss of interest or pleasure in activities once enjoyed, changes in appetite, weight loss or weight unrelated to dieting, weight gain, unrelated to dieting, trouble sleeping or sleeping too much, loss of energy or increased fatigue, increase in purposeless physical activity, example, hand wringing or pacing or slowed movement and speech, actions observable by others, feeling worthless or guilty, difficulty thinking, concentrating, or making decisions, thoughts of death or suicide. Symptoms must last at least 2 weeks for diagnosis of depression. Also, medical conditions like thyroid problems, a brain tumor, or vitamin deficiency can mimic symptoms of depression, so it is important to rule out general medical causes. Depression affects an estimated 1 in 15 adults, 6.7%, in any given year, and 1 in 6 people, 16.6%, will experience depression at some time in their life. Depression can strike at any time, but on average first appears during the late teens to mid-20s. Women are more likely than men to experience depression. Some studies show that 1/3 of women will experience a major depressive episode in their lifetime. Depression is different from sadness or grief bereavement. The death of a loved one, loss of a job, or the ending of a relationship are difficult experiences for a person to endure. It is normal for feelings of sadness or grief experiencing loss often might describe themselves as being depressed. But being sad is not the same as having depression. The grieving process is natural and unique to each individual and shares some of the same features of depression. Both grief and depression may involve intense sadness and withdrawal from usual activities. They are also different in important ways. In grief, painful feelings come in waves, often intermixed with positive memories of the deceased. In major depression, mood and or interest pleasure are increased for most of 2 weeks. In grief, self-esteem is usually maintained. In major depression, feelings of worthlessness and self-loathing are common. For some people, the death of a loved one can bring on major depression. Losing a job or being a victim of physical assault or a major disaster can lead to depression for some people. When grief and depression coexist, the grief is more severe and lasts longer than grief without depression. Despite some overlap between grief and depression, they are different. Distinguishing between them can help people get the help, support, or treatment they need. Risk factors for depression. Depression can affect anyone, even a person who appears to live in relatively ideal circumstances. Several factors can play a role in depression. Biochemistry, which is differences in certain chemicals in the brain, may contribute to symptoms of depression. Genetics. Depression can run in families. For example, if one identical twin has depression, the other has a 70% chance of having the illness sometimes in life. Personality. People with low self-esteem who are easily overwhelmed by stress or who are generally pessimistic appear to be more likely to experience depression. Environmental factors. Continuous exposure to violence, neglect, abuse, or poverty may make some people more vulnerable to depression. How is depression treated? Depression is among the most treatable of mental disorders. Between 80% and 90% of people with depression eventually respond well to treatment. Almost all patients gain some relief from their symptoms. Before a diagnosis or treatment, a health professional should conduct a thorough diagnostic evaluation, including an interview and possibly a physical examination. In some cases, a blood test might be done to make sure that depression is not due to a medical condition like a thyroid problem. The evaluation is to identify specific symptoms, medical and family history, cultural factors, and environmental factors to arrive at a diagnosis and plan a course of action. Medication. Brain chemistry may contribute to an individual's depression and may factor into their treatment. For this reason, antidepressants might be prescribed to help modify one's brain chemistry. These medications are not sedatives, uppers or tranquilizers. They are not habit-forming. Generally, antidepressant medications have no stimulating effect on people not experiencing depression. Antidepressants may produce some improvements within the first week or two of use. Full benefits may not be seen for 2 to 3 months. If a patient feels little or no improvement after several weeks, his or her psychiatrist can alter the dose of the medication or add or substitute another antidepressant. In some situations, other psychotropic medications may be helpful. It is important to let your doctor know if a medication does not work or if you experience side effects. Psychiatrists usually recommend that patients continue to take medications for 6 or more months after symptoms have improved. Longer-term maintenance treatment may be suggested to decrease the risk of future episodes for certain people at high risk. Psychotherapy. Psychotherapy or talk therapy is sometimes used alone for treatment of mild depression. For moderate to severe depression, psychotherapy is often used in along with antidepressant medications. Cognitive behavioral therapy has been found to be effective in treating depression. CBT is a form of therapy focused on the present and problem solving. CBT or the cognitive behavioral therapy helps a person to recognize distorted thinking and then change behaviors and thinking. Psychotherapy may involve only the individual, but it can include others. For example, family or couples therapy can help address issues within these close relationships. Group therapy involves people with similar illnesses. Depending on the severity of the depression, treatment can take a few weeks or much longer. In many cases, significant improvement can be made in 10 to 15 sessions. Electroconvulsive therapy, ECT, is a medical treatment most commonly used for patients with severe major depression or bipolar disorder who have not responded to other treatments. It involves a brief electrical stimulation of the brain while the patient is under anesthesia. A patient typically receives ECT 2 to 3 times a week for a total of 6 to 12 treatments. ECT has been used since the 1940s, and many years of research have led to major improvements. It is usually managed by a team of trained medical professionals, including a psychiatrist, an anesthesiologist, and a nurse or physician assistant. Self-helping and coping. There are a number of things people can do to help reduce the symptoms of depression. For many people, regular exercise helps create positive. For many people, regular exercise helps create a positive feeling and improve mood. Getting enough quality sleep on a regular basis, eating a healthy diet and avoiding alcohol, a depressant, can also help reduce symptoms of depression. Depression is a real illness and help is available. With proper diagnosis and treatment, the vast majority of people with depression will overcome it. If you are experiencing symptoms of depression, a first step is to see your family physician or psychiatrist. Talk about your concern and request a thorough evaluation. This is a start to addressing mental health needs. And these are the references on the site. Yes, hope this was helpful in some way, or it helped you to get some answers as what is depression, what medications and treatments are used, what are the risk factors of depression, and how it is different from sadness and grief. The website for this is psychiatry.org, www.psychiatry.org, American Psychiatric Association. Okay, hope this helps. Thank you. Thanks for listening.